What is gout? Also called gouty arthritis. Gout is a painful form of arthritis caused by too much uric acid in the body. Normally, uric acid is filtered and eliminated through the kidneys. When uric acid is too high, it will convert into crystals that accumulate in places in the body such as joints of hands, fingers, knees, feet, eyes, ankles, toes, etc., causing arthritis, local swelling, redness, and pain to the touch. Flare-ups last days in the beginning, but can become progressively longer. Left untreated, gout can cause permanent damage to joints and kidneys. Gout is the most common form of inflammatory arthritis. Gout is most commonly seen in men, particularly those between the ages of 40 and 50. A large number of adults aged 20 and older have reported being diagnosed with gout according to the National Institute of Arthritis and Musculoskeletal and Skin Diseases, NIAMS. What causes gout? According to research, the main cause of gout is the accumulation of too much uric acid in the body. Uric acid is produced from the breakdown of purines present in all tissues and cells of the body. Purines are also absorbed a lot from foods such as liver, animal organs, legumes, anchovies, etc. Increased uric acid is also associated with metabolic disorders such as diabetes, dyslipidemia, etc. There are three main causes of hyperuricemia leading to gout, including congenital increase. Some patients have a deficiency of HGPT enzyme in childhood, leading to unstable uric acid levels, causing early onset gout in children. This case is very rare but very severe and very difficult. Cure when acquired. Primary cause. This is the main cause associated with genetic and family factors. Patients in these cases have a higher endogenous purine synthesis than normal people, leading to an increase in uric acid levels in the blood. Secondary causes. This is considered an external factor, the consumption of foods containing a lot of purines such as animal organs, mushrooms, shrimp, crabs, red meat, etc. Regularly drinking alcohol stimulates the increase. High uric acid in the blood leads to gout. Secondary causes are considered the main cause of gout cases in today's society. In addition, the causes of gout are also associated with diseases such as polycythemia vera, bone marrow pain, impaired kidney function, overweight, lead-contaminated living environment, use of diuretics that make purines difficult to separate. Cancellation is also a favorable condition for gout to develop. Symptoms and signs that you have gout. Gout is not too difficult to recognize. As long as the patient pays attention, he or she can recognize whether he has the disease or not through the typical symptoms and manifestations of the disease. Gout usually progresses in stages. When urate crystals accumulate in the joints and surrounding tissues for about a year, gout will start. Early stage. The early symptoms of gout are still quite vague, so the images of gout in the early stages are not specific. However, at this stage, the amount of uric acid in the blood has exceeded 6.0 mg per deciliter. The pain in the joints is only transient, easily confused with muscle pain. Gout at this stage can only be detected through regular health checkups. At this early stage, the symptoms of the disease are not clear, so the doctor is rarely prescribed medication. Instead, the doctor will guide you to adjust a scientific diet. Limit the intake of purine-rich foods to control the uric acid index in the blood. Phase 2. At this stage, the joints have shown signs of swelling by uric crystal deposition, accompanied by intense pain. Gout symptoms are now quite clear and can be observed with the naked eye. The joints are swollen, red and hot to the touch. The pain at this stage will not last long, usually only about 3 to 10 days. After experiencing the first pain, the patient will not have to endure any more pain for several months or even years. But in the case of a second pain, the patient will have more frequent pain. Stage 2 gout, if not prevented right now, will progress to stage 3, which is quite dangerous. Therefore, patients should not be subjective and disregard but focus on treatment under the guidance of a specialist. Stage 3. The later, the more dangerous gout shows. When the disease has progressed to stage 3, the patient will often suffer from pain. The uric crystals continue to store more and more in the joints, so the pain level will be pushed up. Final phase. This is the final stage of gout and has progressed to chronic. Patients with end-stage gout often experience complications in the joints of fingers, toes, and ankles. The consequences of late-stage gout are joint deformities, destruction of joint cartilage and tissues around joints. The treatment of late-stage gout faces many difficulties and the success rate is often not high, or the treatment is successful, but the ability to function still cannot be restored as the original. Therefore, patients need to pay attention to the abnormal manifestations of the body, seek treatment right from the early stages of the disease. How to cure gout completely and avoid recurrence. How to treat gout with Western medicine. Non-steroid anti-inflammatory drugs. Diclofenac is usually used, 1 to 2 ampules per day deep intramuscular injection. Within 2 to 3 days, switch to oral drug meloxicam, piroxicam, or Feldon injection, colchicine. This is the first choice for the treatment of acute gout attacks because of its selective anti-inflammatory action. The drug is indicated for use as soon as an acute gout attack begins about 12 to 36 hours. However, the dose should be consulted by a doctor because the drug can cause side effects such as diarrhea, nausea, increased risk of liver failure, kidney failure, bone marrow failure. Corticosteroid drug group. Used in some special cases such as polyarthritis at the same time. Unresponsive to colchicine, non-steroidal drugs or are using some intra-articular injection preparations. However, this group of drugs is rarely used due to many side effects. Some pain relievers contain paracetamol such as efferalgan, efferalgan codeine, alkaline salt nabica mixed with drinking water or alkaline mineral water to alkalinize the urine and avoid stones. How to definitively cure gout at home with perilla leaves, natural herbs. Perilla leaves have a warm, spicy taste. When entering the body, it will supplement the kin, heart, lung, and spleen, beneficial for circulation, clearing heat, detoxifying, promoting the elimination of uric acid from the body. Perilla leaves contain natural antibacterial and anti-inflammatory properties. Regular use of leaves helps to reduce inflammation and pain in joints. Ingredients: limonene, dihydroquinone, C, pinene, have the ability to inhibit the activity of xanthan oxidase enzyme, limit the formation of uric acid in the blood, and effectively prevent complications. Osteoarthritis experts recommend that patients should use perilla leaves regularly to neutralize the amount of uric acid in the blood, thereby reducing urate salt crystals deposited in the joints, reducing recurrent severe pain, limiting joint deformity. In addition, this leaf also provides a lot of fiber, essential vitamins to prevent diabetes complications, kidney failure, etc. Expert's Guide. The most effective way to use perilla to repel gout today. Treating gout with perilla leaves is very simple, has high safety, is benign and does not cause side effects. Patients can make medicine from perilla leaves in ways. Drink perilla juice. Perilla leaf tea has antibacterial effects, preventing infection complications in joints. Besides, this remedy also helps to reduce pain, reduce inflammation very well. The processing is very simple. Choose fresh perilla leaves, no decay phenomenon, wash them. Boil with 1 liter of boiling water, add a little salt for 10 minutes. Use perilla leaf juice instead of daily drinking water. Note: do not cook perilla leaves for too long on high heat, because it can lose the nutrients in the remedy. Regularly apply perilla leaves. Combining internal and external treatment is a gout treatment recommended by many experts. Using perilla leaves but using drinking water helps to increase the excretion of uric acid in the blood, relieve pain, and reduce inflammation effectively. Patients should apply perilla leaves according to the following steps. Choose young, fresh leaves, wash them in drinking water. Crushed fresh perilla leaves. Then apply directly to the area of swelling, pain and tophi. Note: when applying the patient limit movement, use 1 time per day and combine with drinking water to achieve the highest effect. Combine perilla leaves in a meal. Perilla leaves are known as an easy-to-eat vegetable, with a pungent taste that is often combined with dishes in the daily rice tray. Eating perilla leaves regularly helps prevent gout complications, diabetes, cholesterol and colds. Patients should note when eating raw perilla leaves. Wash the perilla leaves. Do not use deep or wilted leaves. Soak with salt to thoroughly remove bacteria. For patients with poor digestive system should not eat perilla leaves raw. Use dried perilla leaves. Patients dry perilla leaves in the sun. Then grind it into a fine powder. Every day, use 1 tablespoon of perilla leaf powder mixed with 1 glass of warm water and drink. Maintain regularly 2 times per day. Dried perilla leaf powder is easy to use, convenient for people with busy jobs or often on the go. With long-term use of this remedy, the symptoms of the disease are significantly improved. In addition, drinking dried perilla leaf powder also helps diuretic and stimulates sweat glands, promoting the elimination of uric acid in the blood effectively. Soak your feet in water of perilla leaves. Soaking feet in water of perilla leaves helps to relax the tendons and bones, helping the blood to circulate easily. Performing this treatment regularly, patients can see a significant reduction in pain, and the size of tophi particles also decreases rapidly. Patients can also combine foot soak and eat raw perilla leaves to lower uric acid levels in the blood. Patients soak feet according to the following instructions. Boil fresh, aged perilla leaves with about 1 liter of water for 10 minutes. Then let the water cool down, to avoid burning the skin. Every night before going to bed soak for about 30 minutes. Patients should be patient to achieve the best results. Treatment of gout with perilla leaves is a folk method that many patients believe and choose. Note when treating gout with perilla leaves. Curing gout with perilla leaves is highly effective, helping to improve symptoms quickly. However, patients should not abuse this method. When using too much perilla leaves in a short time, patients often experience some of the following side effects. Diarrhea. Leaves contain high levels of fiber and minerals. Continuous use causes loose stools. The essential oil in perilla leaves can cause allergic reactions in some subjects. So before using, you should test the essential oil of the leaves on your skin to see if there is a negative reaction. Patients should not use wilted perilla leaves, because the active ingredients in the leaves at this time have been changed, which is not good for the human body. Abuse of treating gout with perilla leaves can cause side effects such as increased sweating, high blood pressure, etc. Summary. To help improve the effectiveness of treatment, patients should develop a scientific diet menu and exercise regularly. Hope you get well soon and have a really healthy life.